Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? Neurologist sent patient to IED without informing her that imaging showed a glioblastoma, assuring her impending death. He didn't overlook the disease, he overlooked that communication. He just sent her over for you to do the dirty work of telling her she was dying. Geesh, that is the shittiest thing one doctor can do to the next. Now imagine you're a nurse that just read the diagnosis in the chart, and as you go to educate the patient on management or meds, the patient says, "I have what? Let me call the doctor." Giving a diagnosis is way above my pay grade. That happens to us in pharmacy too. This med is for what? It's a garbage feeling, and I try to backpedal super fast. This is so common. I used to work in maternal fetal medicine, and every single week, we would have women referred to us because their doctor couldn't see something clearly with the baby and wanted to double check. Nope, they just didn't want to have to be the ones to tell you that your baby had a complex cardiac defect or multiple anomalies indicative of a genetic syndrome or any other of a large number of horrible things that can happen during fetal development. Still pisses me off when I think about how many women waited weeks for more information because their doctors were cowards who couldn't tell them. There's something seriously wrong here. I can't see it quite clearly, didn't sound serious. So the appointment wasn't made with any urgency, and now you're 24 weeks pregnant with a fetus that will not survive infancy, and have no options but to carry it to term and hope for a quick and painless death shortly after birth. That's just terrible. The doctors can't change the prognosis of these cases, but the least they could do is tell the mother early on so she can decide for herself whether to carry to term or abort. Since many places don't legally allow abortions past a certain point in the pregnancy, I believe about 21 weeks, since that's the point of viability. AIDS, as in, the patient had no working white cells whatsoever. It all started with what appeared to be a fungal infection in the chest, but after many pulses with itraconazole, the plaque was still present and growing. So the physician called me to check the patient, and the chest plaque was indeed very suggestive for a fungal infection. The direct examination even confirmed the existence of the fungus, but the treatments were doing nothing. So I rechecked the file, and lo and behold, the leukocytes count was quite low. A quick HIV test later and the patient was diagnosed with AIDS on top of its body fungus. To the credit of the physician that called me, the patient lied on the clinical exam as he marked he had no active sex life, but when confronted with the evidence he spilled the beans. Turns out he was a regular with the local hookers, but also quite active in online dating. Public health wasn't happy, to say the least. MD here recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Bleeding a little. 'Tis but a scratch. In residency I saw a cardiologist miss a STEMI. Heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though. It was obvious on EC. It was like textbook tombstones on the EC. No idea how it was missed. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful. Not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly I don't know what happened to him. Not as bad as that, but I had neck and shoulder pain and stiffness for about 5 years with docs telling me it was just soreness. Text neck, etc. and prescribing NSAIDs and muscle relaxers. Finally a new doc said to see a rheumatologist. Diagnosed with ankylosing spondylitis. Doc said it is often misdiagnosed or left undiagnosed. Frustrated me for so long because I knew something was not right. Edit. For those who aren't familiar, this is a great video about living with AS. If this post encourages someone to get a referral and helps to catch something earlier on, I will be super happy. AS may not have a cure, but it can be managed to some degree. Edit 2. Holy hell. Thank you all for the support and for sharing your experiences. I'm going to try and respond to everyone. I'll be very clear that I am not in any way, shape or form a medical professional, so I can only share my personal experience. But just knowing that some of you are going to look into your own symptoms with your doc is freaking awesome. And as others have noted, you can join the party on our ankylosing spondylitis. Yay us. Once when I was a medical student on surgery rotation, in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen, and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, next set of vitals, his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. Frown. My SIL was fobbed off with the exact same thing. Young female severe chronic abdominal pain. Finally referred for a scan which was cancelled because she was low risk. She was again in a lot of pain, so my brother insisted she be checked again, this time by a new physician who decided to do a rectal check. Diagnosed with colon cancer there and immediately referred for a scan, then to the best specialist in the area. Chemo, removal of most her bowels, narrowly avoided a bag and a lifetime of adjustments, but thankfully in remission now. 2 years of being diagnosed with piles instead. I run into this a lot as a surgeon. Very few primary care providers will do a rectal exam. Just tell the patient that rectal bleeding, probably hemorrhoids, and give them ointment. If it doesn't resolve within a few months, I get the referral for hemorrhoid surgery and find the rectal mass. Either that, or find a colon cancer on the colonoscopy that they should have ordered months ago. Yup, exactly. Also a surgeon who has seen far too many fungating distal rectal cancers in patients diagnosed with hemorrhoids for ages. Probably the worst story one can hear. My wife found a lump under her breast that was really concerning. It took her about 2 months to get a proper appointment to have it looked at. Doc diagnosed it as a cyst and fibroadenoma. She drained the lump and it was fine. Grew back a week later and was bigger. Finally, after being in pain for weeks on end, the doctor said this is clearly not working, so we will do surgery and remove it. Upon going in for the checkup, thinking they'd take a look at the scar and healing, it turns out that she had stage 2A triple negative breast cancer. The surgeon was absolutely flawed. The most upsetting thing was that while her main surgeon, gyno, who was fantastic, was on holiday, another male doctor told her any surgery would be merely cosmetic, and it clearly didn't bother her because he could touch the lump. I almost laid that doctor out in the office. When she got the diagnosis, he apologized to both of us for being an asshole. Unfortunately, this story didn't end well. Despite doing 8 months of therapy, chemo and radio, her cancer returned 7 months later and ultimately led to her death after it spread to her brain and spinal fluid. So many people told me breast cancer, that's one of the easy ones. My insert relative nobody fucking cares about here had it. She switched gynos twice because they wouldn't take it seriously. It's been 6 months now and not a day goes by where I wish I could have taken her cancer away. She was fucking 27 years old. Not a doctor but the patient. When I was born, I was my dad's 3rd child, 2 from a previous marriage. He knew something was wrong with me because of the way I was breathing, very rapid, short breaths. When I was 3 months old, they noticed there really wasn't a change. The first hospital he and my mom took me to, they said that there was nothing to worry about and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital, and they said there's definitely something wrong, but they didn't have the technology to help. 1986. They recommended us to a third hospital, which was a couple hours away. Finally, the third hospital took me right in and performed surgery that day. Turns out I had 5 holes in my heart. They tried to go through my rib cage, but it didn't work. They had to crack my sternum and go directly through my chest. They took my heart out of its body and patched the holes. I'm doing wonderfully medically today, and I'm forever in their debt. Not financially, thank you Ronald McDonald House. I was a few days old and my parents' first and only child. My mum saw me turning bright red and blue around the lips when I cried. Mum demanded the pediatrician, to which a nurse told her, "Oh Mrs. Salway-Orian, this is your first child and you wouldn't know." She replied, "I teach child development at the tertiary level and this is not normal." Got the pediatrician in and boom, I have tetralogy of Fallot. Edit, misspelt Fallot as fallouts because it was 4 AM when I made the comment and I suspect my phone auto-corrected. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays, told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. Holy shit, losing a foot is a serious consequence to something so normal. I don't understand why they wouldn't do an x-ray. Of all these stories, this one is the strangest to me. Why would you give someone a moon boot and not x-ray? Are all these stories sheer incompetence, or are hospitals in America for profit / won't do things deliberately to save money? One that comes to mind is when I was a resident. The ed doctor wanted to admit a mild septic patient with a UTI. I review her labs, and knowing that she is a diabetic, it was obvious florid aka diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive fluid rehydration. She was just in the ed hallway with no medications at all, looking like crap.